name is Anna Stafford. I'm a nurse with Tulare County Child Welfare Services. I am teaching this class to fellow nurses. It is a 2.5-hour class where they have been given a link to this article, and they were to come prepared, ready to talk about it in class, as well as they will have markers and poster board to have a discussion time, and then they will present that discussion information to the rest of the class. Good morning, class. How are you today? If you guys could please show me that you have printed out your article and that you came prepared to class today. Thank you so much. Let's hope that we can have some good participation and learn something. I know we'll learn something new today. We're going to do a brief synopsis of the disease process of asthma. It is a chronic disease where the bronchioles become constricted because of inflammation, which then in turn has an immune system response that includes shortness of breath, tightness in the chest, wheezing, mucus, and a dry cough. Some of the causes of asthma, especially here in the Central Valley where we work and live, pollen and allergens in the air due to lots of grow a lot of produce and fruit trees in this area, as well as we are enclosed by mountains on either side, which traps the pollution and pollen in the air. Exercise can induce asthma, as well as stress and infection of the lungs. And if left untreated, asthma can bring changes into the airway, as well as death. One of the main medications that we use, a short-acting beta agonist, is albuterol inhaler. Its mode of action is to relax the smooth muscles and reduce the bronchospasm. If you are taking beta blockers, digoxin, diuretics, epinephrine, antidepressants and MAOIs, and some over-the-counter medications for colds, you're going to want to let your doctor know. As far as how efficient it is a rapid onset from 5 to 30 minutes, will last 4 to 6 hours. It is not to be used alone. It needs a long-acting medication to be used in conjunction with the albuterol. Safety, it can cause tachycardia, hyperglycemia, hypokalemia, hypomagnesemia, skeletal muscle tremors, headaches, nausea, vomiting, and in some cases anxiety. It is relatively cheap at almost $45 to $60 for 200 puffs. And like I said before, it's a rapid improvement in breathing due to the reduction in smooth muscle constriction. Fluticasone is an inhaled corticosteroid, which is the long-acting. Its mode of action is to reduce the airway inflammation by inhibiting multiple inflammatory cytokines and producing long-term control of asthma. So the albuterol inhaler is to stop the spasming, and this is to reduce the inflammation on the inside. So we have a less tight airway as well as one that's opening up. It has interactions with antidepressants, antibiotics, HIV drugs, oral steroids, Tagamet, and heart medications. Proper administration, and that's the main focus of this class today, of proper administration of asthma medication is key. And it can take up to 2 weeks to start seeing good results and effectiveness in the inflammation of airways. Children should use a spacer for proper administration. Severe reactions can be anaphylaxis. Long-term use in older adults could be glaucoma, cataracts, immunosuppression, growth suppression, adrenal suppression, and some common reactions you see are headache. My granddaughter uses this as well as myself, nasal bleeding, nausea, vomiting, coughing, and dizziness. Inform your doctor if you do have glaucoma, cataracts, recurring infections, allergies, or tuberculosis, and of course liver disease. It is relatively cost effective also at $50 for 120 puffs. And again, we are going to see reduction in the inflammation of the airways. So asthma is a huge problem, especially for children in the U.S. and especially in California. There's an 8.4% prevalence of asthma in kids 18 years or less. In California, we're a little higher at 9.4%. overall, and for ages 15 to 17-year-olds, we have a 14% prevalence of asthma. Certain counties of California are even greater than 25%, and we see that often. Improper medication administration is a major problem leading to exacerbation. The Global Initiative for Asthma Study estimates 80% of patients do not demonstrate proper inhaler administration, and 67% of providers do not demonstrate proper inhalation administration. And obviously, proper patient and provider education is necessary. Problems associated with the improper medication administration is we don't get the right amount into our lungs. Then this increases the frequency of asthma symptoms, which will also increase ER visits and hospital admissions, and leading to increased corticosteroid use with long-term effects in children can cause some to not grow as much as they should. How do we get this across to adults, children, caregivers, even staff in medical clinics? We can demonstrate the skill for them, and the research shows, from the article, to make it slow, short, and fun. Repeat the information verbally. So at each visit, at each checkup, when you call them, whatever. Visuals should be given repeatedly, because in this area there is an issue with a challenge for literary understanding. So the more pictures, the better it is. And then children should demonstrate, or parents should demonstrate, and providers too, back to the provider who's teaching them. So in the article, it gave you this cool, nifty little piece of paper that showed you a drawing of that the article writers used. And it's interesting that the writer of this article is actually my granddaughter's pulmonologist at Valley Children's Hospital here in California. And my granddaughter was going to be featured on this, but I've been sick, so she's not able to be here at this time. But she can tell you word for word and explain via using this same picture exactly how to properly administer any inhaled medications that she takes. So now we're going to do that group activity we talked about. I've got your markers and I've got your paper. And so you're going to divide into groups at your tables, and you're going to discuss 3 components of how to help parents and caregivers and children to properly administer medication based on what you've read, based on what we've talked about. What kind of verbal information are you going to give them? What kind of picture information would you give them? And what kind of teach back information are you going to give them? So we'll have 20 minutes to discuss that. So 20 minutes has gone by. So now it's report back time, class. Who would like to share their poster, and who would like to explain verbal information on their poster? Thank you. Okay, next group, who would like to explain about picture information that they decided would be good? That's awesome, thank you. And now some teach back information that another group thought would be very good. Excellent, you guys are great. I like the participation and the fact that you're utilizing the information from the article as well. Shows that you've come prepared. So prior to this quality improvement study that I had you read, the average age of the child in this case were 9 years old. 60% had mild persistent asthma. 91% were covered by Medicaid funded programs. And 77% were using some sort of inhaled medication. 33% of them were using a mask, which would include a nebulizer. And children could only properly explain little less than 3 of the steps of administration, and that's less than half. That means that they are not getting the proper administration of the medication. Well, after this quality improvement study, 100% of the participants used the inhaler only, so we dropped the 33% using masks. 3 months later, children could properly explain and demonstrate over 4 steps correctly, and 6 months later, 100% of the children could properly demonstrate all steps. Staff, they were 100% with the administration of medications throughout the study due to continued reminders, and they would have to submit questionnaires after they spoke with their patients. So now we're going to have a scenario. An 8-year-old child presents in the ER with anxiety, labored breathing, coughing, and complaining of tightness and burning in their lungs. The child's mother states that they have been using the albuterol inhaler before bed and upon rising in the morning. The mother states it is not helping the child and his asthma is only getting worse. The nurse should select all that apply, and you're going to discuss these in your same groups. Explain that albuterol is a fast-acting medication and should be used as a rescue for acute situations. Ask the mother if the child has any other medications. Discuss what the child was doing prior to the acute asthma attack, and have the child demonstrate administration of the albuterol inhaler. You guys will have 15 minutes to talk about which ones you think are right, and then we'll talk about it. All right, 15 minutes is up. Let's look at the answer. A, B, C, and D are all correct. Why? Because albuterol is a quick-acting medication for acute attacks. The child should be using a long-acting medication in conjunction with the albuterol. Triggers are very important information in helping prevent future asthma attacks. My granddaughter has to take a puff before she does her PE. We figured that out. Proper administration of asthma medication is the key to preventing exacerbations. So, as this class concludes, I would like for some volunteers to name one or more new things that they learned in this class and how we can apply it to our work. And I really want to thank you today, because together we can help children with asthma live more productive lives. Thank you, and if you have any questions, I'll be sticking around after class. And there's the references. And that's how the class will conclude. And thank you for watching.